this is Julia with Loudoun Medical Aesthetics here with Michelle, and we are now going to be discussing fillers. So the fillers that we use here at the office range from hyaluronic acid fillers to calcium fillers, which are a little bit different in viscosity. Different fillers we use for different areas in the face. Under eyes, a lot of people have problematic areas under their eyes, whether it's darkness, whether it's hollowness, loss of volume. They might have tried creams, they might have tried different procedures like facials or even microneedling, which does help, but it's not something that can completely fix the volume loss. So while certain procedures help in between the fillers and the Botox, they won't completely eradicate all of your problems. So under the eyes, when somebody has a hollowness under the eyes, what we do is we actually go in with a cannula, so you don't have to worry about any bruising, you don't have to worry about any swelling. Some practitioners, they go in right with a needle right along the tear trail, and you really never know when you're going to hit a vessel, an artery, a vein. It's really hard to gauge when you're doing it with a needle. When you're doing it with a cannula, it's 100% safe. You really have nothing to worry about. So we make a tiny, tiny little entry point, and I would go in with a cannula and kind of fill in this hollowness, which Michelle obviously doesn't have, but some people complain about the hollowness here. It's called the tear trail. It literally looks kind of like cusp right underneath the eye. So you have to be a good candidate, and not everybody is a good candidate for it. If you have a lot of what's called adipose tissue, fatty pads underneath the eyes, you probably won't be a good candidate for that procedure, but most clients, most patients are good candidates for that procedure, and they really do see a huge, huge difference, and it's immediate, it's right away. You see the results right away, and the downtime is very, very minimal. You don't see the bruising, you don't see the swelling. You kind of just have to wait for the material to settle out and just smooth out over the course of about 5 to 7 days. The other areas of the face that we can do filler are temples. A lot of people have hollow temples, so as you age, you lose the volume in the upper face as well as the lower face, but when you lose volume on the upper face and the temples, it really shows, especially if you have a strong bone structure. So you can have nice defined cheekbones but hollowing appear, and that does age you quite a bit. So filling in that area there, which also is done with cannula, so you don't have to worry about bruising or swelling or anything like that, is quite drastic. It really does make a huge difference to help smooth in the transition from the temples kind of to the cheek and cheekbone. So when we do cheekbones, depending on the client, depending on the age and what you want, how thick you want them, how thin you want them, is kind of how we determine what product to use. Calcium fillers, radius, does last longest. It lasts about 2 years, maybe 2.5 years, and it does give you the most drastic result. Other people may want more subtle results, kind of a little bit along the cheekbone, just a slight plumping. In that case, we would use a hyaluronic acid filler that would last about 18 months. So fillers really can be used anywhere in the face, the nasolabial folds, the marionettes, the lips, but not a lot of people focus on the tear troughs, the temples. So yeah, if you have any questions at all, please, again, visit the website www.loudounmedicalaesthetics.org. We have tons of before and after photos of tear troughs, of temples, of cheeks, and give us a call for your consultation. The number is 703-444-2777. Thank you so much.